Stress and the autism parent. Most parents experience stress, but for those raising children with autism, everyday life often brings stress with a capital. They need to keep their child from running away, manage meltdowns, wrangle with teachers about special education needs, avoid sights or sounds that overload his senses, and drive to the therapist or doctors. They do all this while sleep deprived. Many children with autism simply don't sleep well, so neither do mom and dad. Researchers have taken notice. More than a few studies report that parents of children with autism experience more stress than parents of typical developing children and parents of children with Down syndrome. Parenting stress. Parents of children with autism were more likely to score in the high aggravation range than parents of children with developmental problems other than autism. Parents of children with special health care needs without developmental problems, and parents of children without special health care needs. However, within the autism group, the proportion of parents with high aggravation was for those whose child recently needed special services and for those whose child did not. The parents of children with autism and recent special services needs were substantially more likely to have high aggravation than parents of children with recent special services needs in each of the three comparison groups. Conversely, parents of children with autism but without recent special service needs were not more likely to have high aggravation than parents of children with other developmental problems. Finding a low-cost solution to parenting stress. Some families may not have the time and money for therapy, but one group of researchers tested a relatively low-cost solution: parent-led support groups. For the study, professionals taught and supervised parent mentors to provide one of two therapies: mindfulness or positive adult development. The mentors were themselves parents of children with disabilities. Researchers randomly assigned parents of children with autism and other developmental disabilities to one of the two therapy groups. The mindfulness group learned special breathing and relaxation techniques, meditation, and other exercises to improve coping. Meanwhile, parents in the PAD group learned to combat worry, conflict, and pessimism by identifying and using their strengths and abilities, and to perform exercises involving kindness, optimism, and gratitude. Both groups of parents saw significant reductions in stress, depression, and anxiety after 6 weeks of treatment. The mindfulness group members fared better with anxiety, depression, and sleep, and their sense of well-being. What does mindfulness look like? Let's say your child is having a meltdown in the store. First, you realize and accept your anxiety and frustration. Then you focus on how to respond to his meltdown without letting your thoughts about the stares of other shoppers affect your decision making.